Hello, everyone, and welcome to a fresh episode of ATP Hour Ask the Pediatricians. My name is Bimisala Boyede. I'm a pediatrician, and I'm here today with a fresh episode of discussion on things that affect the health of our children. And I'm so excited about what I have brought to us today because this is actually one of the things we do on Ask the Pediatricians Foundation. Ask the Pediatricians Foundation is a non-profit that is committed to the health and welfare of all children globally, especially in Africa. Our mission is to see that no child die from preventable causes of death. And that is what we do. We do that through health education and information like we are doing on this platform right now, and also like we do on our Ask the Pediatricians Facebook group with over 700,000 parents. And also we do free community medical outreaches to children in indigent communities throughout Nigeria. And I'm excited to let you know that we are going to be having our first set of outreaches for 2022. Yes, our Children's Day community medical outreaches is coming up in May and June 2022. So watch out for Ask the Pediatricians Foundation outreach in a community near you. We welcome you to support us. You can sponsor one child for 5,000 naira or $10 of £10. All our details, our account details, they're showing on the screen. And for those who are listening to me on the podcast, you can actually donate to our accounts at Ask the Pediatricians Foundation, Guaranteed Trust Bank 0258 158 136, or you can actually just go to our website and donate online at www.askthepediatricians.com. You will see our global giving link to donate for those outside Nigeria, and for those in Nigeria, you can just donate straight into our bank accounts. We are looking forward to reaching 100,000 children in 37 communities in every state of Nigeria, including the FCT Abuja. So thank you so much, and we look forward to your support. If you need more information, please send us a message on our WhatsApp number or any of our email or through any of our social media platforms, as you can see on the screen. So welcome, whether you're watching me on Facebook Live on Fresh Waves Radio or Ask the Pediatricians Foundation Facebook page, or you are listening to me live on Fresh Waves Radio or Ask Dr. Bimi podcast, or you're watching me on YouTube. Wherever platform you're watching me from or listening to me today, I really want to say thank you so much for joining me and welcome to this fresh episode of Ask the Pediatricians Hour. And so what am I going to be talking about today? Today we're going to be talking about what we call myths and facts as it relates to the health of our children. Wow, this is very important. In fact, I always say most of the work I do on Ask the Pediatricians Foundation is to break myths and to disturb all the mindset, because especially for those of us in Nigeria and Africa, we come from a background where there are lots of beliefs and things that have been taught to us about things that relates to health of children. We have myths or what we call beliefs about several things that are common. That is the definition of myth, a widely held belief about things, and we have a lot of them as relates to the health of children. The truth of the matter is that some of these beliefs are dangerous. They are myths, they are dangerous as relates to the health of our children. And I see that a lot of our children actually die because the belief system of the parents or the caregivers influence how they handle such issues, and sometimes we lose our children. Some of the myths are harmless, they don't do any harm, they don't also do any good, but some are actually good, even though they are myths and they may look like the belief doesn't really have any scientific basis, but then we don't mind because somehow they are good for the health of our children. So we have what I call the good, the bad, and the ugly when it comes to myths. So today my job is actually to discuss the myths and to tell you the real facts. And I'm going to be looking specifically at myths that has to do with health of children. And there are loads and loads of these myths. I've actually had this conversation on Ask the Pediatricians, and people were telling me all the myths. In fact, most of the questions we do have usually from parents asking based on the myths they've been told either by their own parents or grandparents and all that, and they're trying to find out whether they're actually true or they are not true. So we do get lots of questions. So most of the myths I'm going to share with us in this podcast are actually real questions that people have asked or real things that people have shared with us. So I had a compilation of all of them, and I have a feeling that I may not be able to take all of them in this one broadcast, so we may have to do them as series. But I'm going to start today with myths that has to do with the newborns, newborn babies. So I'm going to do a lot with that. I'm also an author of the First Time Mom Baby Care book. I have the First Time Mom Companion, and I have the series of the ebooks and videos. For those who are first time mom, I encourage you to get a hold of those of the book or the full material, their digital products with videos and all that. You really love it because you will learn a lot about the care of newborn babies. And one of the things that when it comes to the care of newborn babies, that we have a lot of beliefs that the grandmothers and some of our own parents, when they've come over to do what we traditionally call omugo or olojojo, it's basically what it means is that the experienced mothers or grandparents, they will come around when a mother has a new baby to assist her. That is actually a good thing because a new mom needs a lot of assistance, but at the same time they come along with all these various beliefs and rules and myths, and some of them are not in the best interest of the newborn baby. And so what I'm going to do today, I'm going to start with the myths that have to do with the newborns, and then we can talk a little bit about some myths that have to do with breastfeeding if we still have time. And obviously, if we cannot finish, we're going to continue in the next week broadcast. So I want to invite you to just relax and enjoy today's broadcast, and I'm sure it's something that you will always want to reference to in future. Feel free to share the video, feel free to share the podcast, feel free to invite more and more people to listen in, because we are really talking about things that have to do with life and death here, because our mission again on Ask the Pediatricians Foundation is that we don't want any child to die from things that are preventable. And a lot of our children die in Nigeria and in Africa, and majority of our children actually die from things that are preventable. And one of the reasons why our children are dying is because of our belief system or the way we approach the care of our children. And some of these are rooted in myths, and this is exactly what we are going to be addressing today. So some of them are funny and some of them are not funny at all. They are dangerous. So relax and enjoy. I'm sure you said, Dr. Baby, let's start. I want to know the myth. Okay, so let's start with the first myth here. For those who are watching, you can see them showing on the screen. Now, this is a particular myth. The first myth I'm talking about today is that you must use palm oil, what we call epokupa, red oil, and alum with the local sponge to scrub a newborn baby so that they don't smell. So there was a time this was circulating on social media. One of the most popular Yoruba actress, who is now a very elderly mother. I think she's in almost 80. She actually did a video of her scrubbing a newborn baby with this palm oil and sponge, and trying to let people know that that is the right way to care for babies, and I think some people shared that video with me. Actually, that is a very, very dangerous myth, and this is actually common in southwest Nigeria. It's really Yoruba people, and they believe that newborn babies, if you don't scrub them with palm oil and sponge, not soft sponge. This one is a very hard ash sponge that if you don't scrub the babies are going to smell. That this will make baby to smell or develop body odor in future. So that is why babies must be scrubbed very well with sponge and palm oil. Now, the danger with that, actually, it's a myth. Okay, it is completely a myth. Now, number one, babies don't need to be scrubbed. In fact, babies don't really need to have a bath for the first 24 hours of life. That is actually the honest truth, because babies just need to be kept, dry and warm, and they need some of the things on their body. They need it to be able to identify their mother and smell their mother. That is why we actually don't want you to clean them too much, so that because they need some of those odors to be able to know how to know where the breast is. But I will not go into all those details. But the truth of the matter is that there is no basis for you to scrub babies with palm oil and sponge when they are born. Now, you need to remember that palm oil is a very slippery thing, and babies themselves are even already slippery. So in the process of scrubbing them with this palm oil, they can slip out of the hands of the caregivers and they can sustain injuries. This can happen. And one other thing, that sponge, the baby's skin is so sensitive, and when you scrub it, you can create like injuries or damage to the skin of this baby, and baby infection can easily come into that. And that's why you see some babies, even newborn babies, already having all these pores, like bacterial skin infection all over their body. That can also come from the hand of the caregivers who don't wash their hands as well. But it can also come because their skin is being damaged, traumatized by this heavy scrubbing with palm oil and this local sponge. So please, this is a very dangerous myth. Babies just need to be, if you want to give them a bath, a soft sponge and a normal toilet soap is enough. So please do not scrub them with palm oil, and they don't smell. Trust me, they don't smell, because I always ask Nigerians, what about cultures where they don't use palm oil and sponge to scrub their babies? Are you saying they smell and we don't smell because we are scrubbed with palm oil? And the answer is always, it's not true. So body odor has something to do with the fact that a baby was not scrubbed with palm oil when the baby was born. So this is a dangerous myth. We don't want baby to be too slippery. We don't want them to fall. We don't want them to sustain injuries. We don't want their skin to be traumatized because we are trying to prevent body odor, which it doesn't really do anything. So that is one myth. So there's no basis, and it is actually can be dangerous if your baby is scrubbed with palm oil. So let's not do that. So that is the first myth that we are talking about, and I've told you the facts. So there's no basis for that. For those of you who are newborn, first-time mom, and you really want to know what is right and what is wrong, you may want to get a copy of the First-Time Mom Companion. I think I'll just show you a picture of that, and then you will get all this information. All right, okay. So we will go on with, this is just a picture of the First-Time Mom Baby Care. This is the full one, and then you also have the this full one as the book and the videos, and then you have the other one which is just the manual only without the video. So the FTM Companion, and it will be very useful for our first-time mom. This is just the ebook only. All right, I just want first-time moms to know that. Now, the next thing I'm going to talk about is the second myth. Now, the second myth is that if you don't press the belly of a newborn with hot water, the baby will not be able to eat much food. Okay, so this is another popular myth when it comes to the health care of children. And newborn babies, a lot of the grandmothers, a lot of sorry, apologies to all the grandmothers if I'm coming on you strongly today. Believe that babies have to be pressed and massaged and all that, and you have to press their tummy and all that. Actually, this is not true. Okay, baby's tummy does not need to be pressed. Babies actually have very tiny tummies when they are born, and as they get bigger, the tummy gets bigger as well. And so, pressing them with hot water is not going to do anything. And we actually don't recommend all this massaging and pressing with hot water. Number one, I've seen babies sustain burns because the water is too hot. Some of these women can barely hold that water themselves, and yet they want to press either the mother or the baby with this hot water. And there's even actually no basis for it. So we don't want our babies sustaining injuries from hot water just because somebody is trying to do something that doesn't even need to have been done in the first place. So I'm not going to go too much details beyond to say there's no need for babies to have these hot water massages of their tummy. It doesn't do any good. It doesn't make any difference. And there's a potential danger of babies sustaining burns injuries. So we need to stop that. That is the second myth. So let's move on. Another myth, this is so related to the second myth. Again, remember, I'm still talking about myths that relate to the newborns because they have a lot of those ones. And I really worry about newborns, and I worry a lot about first-time mothers who don't know much themselves, and they have all these experienced mothers who obviously they've raised other children, and obviously, thank God, those children survived. Whether in spite or despite the all the myths that, and then they are just like you are the mercy of them. So it is important that you know what is right and what is wrong. And unfortunately, when things go wrong, people don't talk about it, but they come to us, the pediatricians. So we know when things go wrong because it always ends up on our own table. And that's, but I prefer that we don't even have anything going wrong at all. So let's always know the right thing. The fact that sometimes people get away with some of these things does not mean, I just think it's just the mercy of God, but it does not mean we should keep on doing the wrong thing, because that is one of the arguments that people always put forward. Oh, but that's how they've been doing it and nothing happened. But actually, that is why we have more of our own children dying. And that is why in those days, people are not even sure their children are going to survive. So they will have 10 children because they are not sure whether it's only 7 or 6 that will survive, and that is the truth. So some of those dead, they'll say it's a big, some of them are rooted in the practices, in the wrong things that we're doing. So I don't expect those of us who are now in this age of information, the age of knowledge, where you can actually find the right information at the click of a finger on the internet, to still be doing what is wrong just because to say, oh, that's how they were doing it in those days. But that is why actually most of their own children are dying in those days. But they always claim it was a witchcraft, or it was a biku or one of those things. No, that is not it. And that is why even in Africa we still have the highest number of child deaths all over the world. Majority of children dying below the age of 5, they are in Africa because of our either the poor health system, but a significant contribution to that is actually due to some of our belief system, even for those of us who are already educated. So this is one of the things we try to do on ATP, to give you the right information. So please, let's not defend those wrong practices, rather let us learn what is right. So the goal is that our children will be fine and they will survive. And I think that is the same goal you have as well. Okay, so pressing newborn's baby's head with water. So some people believe that, oh, you need to mold the baby's head. The baby's head, when they are born, sometimes their head is looking one funny shape, and they believe that you have to mold it. You have to press it with hot water and shape the head and all that. All those things is absolute nonsense. You don't need to shape the head of the baby. So the way the baby's head is formed is like the baby's head is actually not completely fused together. There are bones, and these bones can go over each other. there's spaces between the bones for them to go over each other and all that. The reason is because the space through which the head of the baby is going to come through is a smaller space. So it's the way God designed it. Baby's head can actually, kind of override each other. The bones can override each other and come out. And when they've come out, they will still go back to their own normal shape. And sometimes, because some babies press so hard on their mother's birth canal, so they have some swelling, what we call caput. All those swelling will resolve by itself. You don't need to press it, you don't need to do anything, it will just resolve. So please, there's no basis for putting hot water on the head of the baby, molding the head of the baby, trying to shape the head of the baby. All those things are not necessary. The baby's head that's override itself will also go back to its normal size. If there's a little bit of swelling, either from caput, or even some babies actually bleed under their scalp, it will still go back to normal. You don't need to do anything. So do not massage the head of the baby. And the baby's head, there are lots of what we call blood vessels running in the scalp, and it's so when we shake the head too much, or we undo it too roughly, the baby can actually bleed in their brain, especially for those tiny premature babies, because those blood vessels, they are very fragile, and there are lots of them. And even ordinary shaking and all that, that's what leads to what we call shaking baby syndrome. It can cause bleeding in the brain, and it can lead to brain damage, and that child can have a lifelong disability. So we really don't want you to be doing all this rough handling and massaging of the head, because you can cause more problems for that baby, and it can be something lifelong. So just leave the baby's head alone and don't massage it, don't do anything. It is fine, and it doesn't require any of that. Now let's go on to the next myth. Again, this is another popular myth, that babies must be massaged with hot water and then be thrown up and down, so that they can be strong. This is a very popular myth, and it is dangerous. In fact, this is one of the most dangerous myths. I remember there was a time some people sent me videos of a typical African mother giving a birth to a baby, and they are massaging the baby. You see the way they are twisting the baby's and twist. That video was so traumatic. It is actually child abuse. It should never be shared. And a lot of people were sending it to me on ATP saying, no, we're not going to share that video. I don't share video of a child being abused. Never. So I didn't share the video, but I was able to draw the message on that. See, all these things people do, all in the name of massaging baby and twisting baby's hand up and down, is wrong. Some babies have suffered fractures in the process. Of course, some of you don't know, because babies' bones are not like our own kind of bone that break, but they can bend. Okay, and I've seen a baby sustain head injury because somebody threw the baby up, and of course they were not able to catch the baby, and the baby fell on the floor and suffered an head injury, blood in the brain. I think that baby actually died. Yes, I remember that baby. I can still remember it. It was one of my cases when I was practicing in Lagos. I remember that baby. You can imagine a mother went through 9 months of pregnancy, and then just a few days, because some people said they want to massage, throw baby up and down, the baby is dead. How do you console that mom? How? And I think it was the mother-in-law that did that thing. How do you console that mom? That was the most heartbreaking situation I've ever heard. So please, some of these things, and I see a lot of first-time moms telling me, oh, I can't talk to my mother-in-law, I can't stop them. And I always tell new moms, I always tell all moms generally, it is your baby, okay? You were the one that was pregnant. You were the one that was having 9 months of inconveniences and all that. As far as pediatricians are concerned, we have only one parents. Children have only one parent, is the mother and the father. So your decision is final. So nobody, and I mean that with all respect, nobody has a right to tell you what to do with your baby. Okay, so your mother-in-law or your own mother cannot come and start telling you how to handle. Now that baby died. I mean, what is she going to say to the mother-in-law? All right. So Stop saying that, oh, they don't, I mean, I can't stop them, they are doing. No, sometimes you got to fight for your babies, and if it means you get into some kind of argument. So I always tell new moms, especially because this is a cultural thing in Nigeria, pick your battles, okay? Pick your battles. So don't, if you fuss over everything, then you're going to be labeled the bad person and all that. But pick your battles. So some things that I will tell you, those things that does harmless issues and all that, just okay, you can let them do what they want. But when it comes to things that are about life and death, like this massaging, throwing baby up and down, it's a life and death, because if your baby drops, that baby will have a severe end injury, that baby can die. Please don't tell me anybody will say, oh, blah, blah, blah. Just tell mama, please don't do it for my baby, I don't want it. And please feel free to call the pediatrician, feel free to blame us, okay? We are happy for you. Tell them the pediatrician say my baby should not be thrown up and down. Yes. Feel free to bring them to our clinic. I always tell some mothers, doc, I'm not sure I'm going to say, just bring them to my clinic and ask the question. Okay, doctor, what do you say about this? Mama will be sitting there, and we will tell her. Yes, we will tell mama that please no, don't do that. So you can have that. I've seen people who take some of our write-ups and they will go and show their mother-in-law. I've seen grandmothers come to my page and they'll say, doctor, we don't know. This is how we were taught. So and so okay, now that we know, we will not do it again. And I'm always very grateful for such grandmothers. I have them, love the grandmothers on our group. So please don't let anybody harm your baby because of these myths. You are the mother. It is your baby. Okay. You are the one that went through 9 months of pregnancy. So it is your baby. And what if you think what they're doing is wrong, please stand up for your baby and say, no, I don't want it. If it is a cultural sensitive situation, you can talk to your husband, to talk to maybe the sister-in-law of the mother-in-law. I'm still going to come back on another day and do a whole um, broadcast about extended family and when it comes to child health and some of the harms that they've done. I'm going to come back for the mother-in-laws and the sister-in-laws and those who are causing harm for our babies, because they don't know a lot, and they forced even the mother who knows the right thing not to do the right thing because she just wants to be respectful. But please, when it comes to the health of your children, please stand for your child and don't allow anybody to force your baby to cause harm to your baby. Honestly, you have to decide that my baby's life is more important than being respectful to this culture or tradition that whatever my sister-in-law says or whatever my mother-in-law says is right. No. When it comes to your baby, you stand up for your baby. So nobody should throw baby up and down. Nobody should twist baby's arms and legs and up and down. All those things are absolutely unnecessary, and they don't cause any good thing. They don't make your baby stronger. They don't stop baby from being fearful or anything like that. No, they don't. So please do not do it. I think I went overboard on that, but I just really need to address that issue because it is a very common issue, especially for those in Africa. I'm sure you all know what I'm talking about. And I really want to empower the new moms, especially first-time moms, to understand that you can stand up for what is right for your baby and you don't allow anybody to force anything that is wrong down your throat. All right, now let's go on. The fifth myths I'm going to talk about has to do with colic. So colic is a situation where babies, they cry a lot and all that, and people recommend all sorts of things for babies. So people say give what we call locust beans or ogiri. You put it in water and you give your baby to drink. Please don't. It's a very dangerous meat. For some of these meats, I'm not even going to go into any explanation. For a newborn baby, all that we want to give your baby is breast milk. Now, when it comes to colic, it shall come to pass. Most of the time, there are things like Infacol that you can give. Sometimes just, rocking your baby, carrying them, petting them. Sometimes you do all those things, they will not work, because the honest truth is that sometimes that treatment will not work. But the good news is that colic will eventually stop. By the time baby's about 3-4 months, colic has gone. So I always tell mothers, no matter what, just hang in there. It shall come to pass. Do not give your baby dangerous products that will cause them harm because you are trying to deal with one problem and you create another. So no, all these products don't give to your baby. Another one say you should massage baby's navel with Lancer. So people believe that when your baby, so that your baby will not have colic, you massage with hot water or lantern and all that. Please, this does not work. Okay, it does not prevent colic, it does not stop colic, but on the other hand, it can lead to the baby sustaining burns. And I've seen newborn babies have burns. Okay, trust me, I've seen it from some of these things. So please do not do that. It doesn't work. There's no basis for putting hot lantern or whatever on your baby's navel. Another one say you should give newborn babies coconut water, to prevent colic. Again, all these things do not prevent colic. They do not treat colic. They do not stop colic. So do not give coconut water. Just give breast milk only to newborns. So another myth says that if your newborn baby's core does not fall early, it will make babies it will reduces this colic or stomach pain. Again, this is one of those, well, neither good neither bad kind of myths, because you are not doing anything. The truth of the matter is that it has no effect whatsoever on colic. So whether some baby's cord will fall within 4 to 5 days, some baby's cord may not fall until maybe 3 weeks. Even I've seen 1 month, I've seen even beyond that. So this thing has to do with other, the baby's body, how to heal and all that, but it doesn't mean anything. So there's no need for you to do anything. You don't have to force the cord to drop. Just leave the baby cord alone. All right. Another myth that boys have colic more than girls. Anyway, these are what I call armless myths. In other words, because they didn't tell you to do anything. So as long as you're not doing anything and they just believe it and they don't use it to action, to do any form of action, sometimes I don't bother myself, but this is not true. Both the boys and the girls can have colic. And like I said, colic is one of those conditions. So when it comes to certain conditions in medicine, it is not everything that doctors have treatment for. That is the honest truth. And it is not everything that requires treatment. That is the honest truth. So there are some things that we just do what we call watch and wait. It will stop. It will go by itself. Colic is one of those things. If you try Infacol, if it works for you, fine. If you tried, rocking the baby, carrying them up and down and all those, dancing for that. If it works for you, maybe it's white noises and all that, it's fine. But what we'll know is that no matter what, it will stop. So just hang in there. All right. I'm moving faster now. Okay, this one, some people believe in what they call kafura pelebe. I remember when I had my baby too, my mom was like, oh, when my baby had, of course, most babies have colic, that, oh, we should put this kafura pelebe in water and give the baby. I said no. So in fact, generally my default position is anything they're asking you to give to your baby to drink, just say no. Honestly, if you do that, you will just be fine, because all that your baby needs to take in through the mouth is just breast milk. So all these rashes, let's boil red flour, hibiscus flour, and use it to bath and then use it to drink so that baby will not have rashes. No. So once they say that thing, no matter what that thing is, they're going to put it through the mouth of your baby, and it is not something a pediatrician has recommended, and it is not breast milk. Just say no. If you say no to that, you will avoid most of the myths complications. Okay, so please do not give kafura pelebe to babies. That kafura pelebe is called naphthalene balls. It is a very, very dangerous chemical. Okay, it's a very dangerous chemical. It can cause harm. I think on our Facebook group I listed all the complications, but I invite you to be my guest to go and Google the side effects or the complications that naphthalene balls can do to the organs of the baby's body. Go and Google it by yourself, then you will notice that it is not true, and you should never give it. Again, like I said, it doesn't cause any relief for a child who has colic, but it can lead to a lot of danger. And I know some people believe that, some camphor or what we call naphthalene balls, some of them are edible. There's nothing edible about it, okay? These are dangerous chemicals. They are not meant to be consumed by human beings. I don't know how we got to the point where we believe that these things should be given to babies. Given to babies, please do not do that. So please do not give your babies kafura pelede or camphor or kafura, any of them. Please don't give. Okay, another myth, still again, I'm still talking about myths that has to do with newborn babies, is that you need to cut the baby's cord in a straight line and wash it um, and wash so that it will reduce colic. Again, it's not true. It doesn't do it doesn't have any effect whatsoever on colic. But so whether you cut the cord in a straight line, you cut it diagonally, it doesn't have. The most important thing for us is that when you cut the cord, you ligate it. In other words, you put the cord clamp so that the baby doesn't bleed from the cord, because baby can easily bleed from the cord and lose all the blood at the same time. So that is all. Was whether how you cut it, how long, how those doesn't really matter. The important thing is cut and clamp. That is the most important thing. All right, let's go on. Another myth says you should give baby ororo giri, like oil extracted from fermented melon. Again, I've just given you a general principle. When it comes to things going through your baby's mouth, just say no. Okay, because the only thing that should be going through your baby's mouth for any reason is breast milk. The only other thing that can go through baby's mouth is if your doctor has recommended a particular medication for a particular reason. Otherwise, do not give anything. Ororo giri, kafura pelebe, coconut water, anything, do not give it. Or flour that has been boiled with water, don't give it to your baby. Those things are very, very dangerous. Remember that the baby's organs are still being, they're still very tender and not fully matured. So putting all these things on them, because what normally happens is that whatever we put through our mouth, some of organs, the liver, the kidneys, they have to deal with them. If they are good, they keep some in the body. If they are not, they try to remove them. So when you put those things in your baby's mouth and it goes to their body, their organs are not even strong enough, mature enough to clear some of these products, and they can actually shut down those organs or cause damage to them. So you don't want to give your baby anything that has not been recommended by your doctor or your pediatrician. Now, another one, this is a popular myth, okay, that when your baby has hiccups, you should give them water, or you can put a strand of clothes, wool in their head. And remember, my mom does this a lot. So when your baby is hiccuping, they'll just quickly cut off the clothes and from the shawl or something and put on the head. Again, this is one of those myths I call harmless myths. It doesn't do anything, okay? It doesn't stop the hiccups. Hiccups are going to stop by themselves. Whether you put clothes in the head or you don't put clothes in the head, it's going to stop by itself. So it's very unnecessary, but it's harmless. At least there's nothing go through your mouth. But please do not give water. So if baby is having hiccups, do not give water. We want you to give breast milk only. So if you think I know the challenge is that mothers we always want to do something. So something is happening, we must do something about it. So baby is hiccuping, we feel like we just have to do something. But the honest truth is you don't have to do anything, because it's going to stop by itself. But if you want to do anything, just breastfeed your baby, but don't give water. You can give breast milk, it's fine. If you even want to put your clothes in your head, it is harmless, but do not give water or anything else through the mouth. But the good news is, I can reassure you, is that hiccups will resolve on their own without any of those behavioral actions. Okay, for those who are just joining us, we are talking about myths and facts in children health, and I've been talking about those that especially are related to the care of the newborns. So I've talked about the fact that you don't need to use palm oil to wash the baby's skin or any of the heavy sponge. You don't need to massage the tummy of the baby. You don't need to massage their head or mold their head. You don't need to press the navel with hot water or hot clothes put on the lancer. You don't need to give anything for colic like ogiri jebu, locust bean, or kafura pelebe, or coconut water, or ororo giri, or whatever. You don't need to give any of these things to your baby. And of course, the fact that your baby is caught in any particular way, it has no effect on the baby. And the myth about colic affecting mostly boys is not true, and it affects both boys and girls. And then we've talked about the hiccups will start by itself. You don't need to do anything about it. All right, let's go to the next myth. The next myth is that for female babies, newborns, that you have to press the clitoris. I'm going to spend a little bit more time in this area because this is actually what we call female genital mutilation. So a lot of the different way people practice it. So some will press it down, some will apply powder and tuck it in, some will actually cut the clitoris, or cut not only the clitoris but almost the whole of the vulva, and even sew it up. I'm here to let you know that you don't need to do anything to the female genitalia, the female, the clitoris, the vulva, that part of the female that you can see in the private area. You don't need to do anything to it. Okay, we don't need to do anything to it. And unfortunately, women, we are the ones championing some of these archaic, barbaric practices, which are very dangerous. In fact, it's so dangerous that it is a criminal offense. In UK, it is a criminal offense in many countries. If the police know that you have circumcised your girls, they will come arrest you. I'm telling you the truth. So please, let's stop it. And why are we so particular about this female genital mutilation or circumcision? Is because it doesn't do any good to the babies. It doesn't do any good to the girls. Okay, people believe that girls will be promiscuous if they are not circumcised and all that. No, it doesn't stop them from being promiscuous. Okay, it just stops them from enjoying sex. That's all. But it doesn't stop the girl that wants to still be promiscuous from being promiscuous, because those has to do with morality. Those has to do with the way we bring up our children. So there are a lot of people, a lot of girls, women, astounding women who are doing great things, and they are not promiscuous and they were not circumcised. So your child being promiscuous is nothing to do with circumcision. It has to do with the training, okay, our parenting, the way we bring up our children. So, but the danger of female circumcision, when girls are circumcised, number one, immediate danger, the child can bleed, and children can bleed to death from female circumcision. Two, they can have infection around that area. Terrible infection, because most of the instruments even used, they are not sterilized. But even these days that people are now becoming, okay, we don't want infection, we will go and use even nurses, or we go and use healthcare professionals to do female circumcision. It is still wrong. It is a violation of human rights of those girls for you to circumcise them. It doesn't matter what you do. And for some people, okay, we're not going to circumcise, we're only going to be talking anything, we're only going to applying powder. Dangerous practices. So immediate ones are the ones I've mentioned, but long term, those girls struggles with having sexual intercourse. They don't enjoy it, because most ladies feel their pleasure from the clitoris, and this is what is cut out during female circumcision. And so you see them in their husband's house, they don't have any form of orgasm, they don't enjoy having sexual relationship. Some of them struggle with having babies, so they because some of the way they do that thing, it can lead to infertility. And if it doesn't even cause infertility, sometimes it can lead to the fact that when they want to have baby, there's obstruction to the birth of the baby. So there are many dangers related with all this female circumcision. And the only reason many people still practice is just that it's cultural. It is just traditional. It is what they've always known. And as if they must always do it. We don't always have to do it. And I keep repeating it. The fact that we've always been doing something and it's traditional doesn't mean we need to continue when we now know better. Okay, I used to tell a lot of mothers who bring these arguments when I'm teaching about this. There was a time that we think having twins is not good. And I remember that they were killing twins in some parts of Africa, like even Nigeria, until somebody like Mary Slessor came in, and stood up for those twins and make it stop. I was the last time we were having our pediatric association conference in Calabar. I went to her grave, and I was very proud to know that that woman was buried in Nigeria, because she stopped that barbaric act of killing twins. So let's stop this female circumcision. I think it should stop with my generation. Okay, if our mothers don't know better, they were practicing it. Why should they continue with us, our own generation? We definitely know better. So we should not circumcise our female girls. And every other form of trying to do something with the female genitals, it is not right. Let's just stop it, okay? Let's stop it. And it is wrong. And this is also, even apart from those who are using powder or pressing it down, some people actually cut it. They cut the clitoris, they cut the vulva. I think we've had a spotlight session on female genital mutilation, but I decided to bring it out because it's one of the major myths and beliefs, because people are saying they are trying to protect against promiscuity in future. I've seen a lot of girls from areas where they circumcise girls routinely, and they're still promiscuous. And I've seen girls that are not circumcised, and they are not promiscuous. Okay, so this thing has nothing to do with this female circumcision. We're actually giving these girls a bad, it's a violation of the human rights. We're actually doing them bad by doing this. And I think if all the mothers from my own generation going forward will say no to female circumcision, then we can actually put a stop to it finally in all over the world. All right. Now, another myth I'd like to address is that, okay, so those are the major myths as regards to the newborn baby and the care of the newborn baby. Now let's go a little bit into breastfeeding. Okay, so there's a myth that say you must not breastfeed babies with tears in your eyes. Okay, I don't know what to say. Anyway, this is actually not. It is neither good nor bad. I would say it's one of the harmless myths, but it doesn't really matter. You can breastfeed your baby no matter which emotion you're feeling. But maybe there's a little bit of some thinking or sense in that myth, in the sense that if you are a mom and you're sad or you are stressed, you're moody, it can actually affect your breast milk, because you produce some hormones when you are stressed, when you're anxious, and those hormones, we call them stress hormones. And stress hormones are anti-breast milk production, so they work against the hormones that produce breast milk. And so in that case, such people, their breast milk production will go low. And that is why we always say, think about your baby, relax if you want to breastfeed. And so, but if you are stressed, it will affect your breast milk production. So maybe there's some sense in that, but it doesn't really matter. Just breastfeed your baby, and the more your baby suck, the more the breast milk will flow. Now, this is a popular one. I remember being told this one when I had my first baby. So my mom will always say, I don't lie on your back, because your breast milk is going to go back, like it's going to go into your tummy or something like that. But this is not true. So whether you lie down on your back, on your side, doesn't really affect your breast milk flow. Okay, and it doesn't mean your tummy will be big. Your tummy being big has to do with what you eat and your exercise and all that, not because you were lying down on your back. So this is maybe an harmless myth, or maybe it's one of those myths that doesn't really make much difference, but it's also a popular myth. And mothers are always very conscious of how they sleep and all that, but it doesn't really have any effect whatsoever. Now let's go on to the number 18. Some people believe that you should not lie down to breastfeed baby, that when you lie down to breastfeed baby, it will lead to the breast milk will go into the hairs and cause hair infection. I do get these questions a lot, but actually this is not true. Okay, so lying down to breastfeed does not cause hair infection. Some mothers are not very the position we should breastfeed is a skill, it's an art. So some people are not very comfortable, they don't know how to hold the baby when they're lying down to breastfeed. So we have many breastfeeding positions. The commonest one is when people sit up, but you can actually breastfeed lying down, you can breastfeed. There are many different positions. So if you watch our breastfeeding videos, you will, or the one produced by Global Health Media, you will see the different positioning for breastfeeding. It doesn't really affect your baby in any way. But what I always recommend is that make sure you know and you have mastered the position. So if you're a new mom or a first time mom, your baby is still very tiny, you don't know how to breastfeed lying down, then it is okay for you to sit up to breastfeed your baby. Don't force your baby to suck lying down, and because because the major worry for us is if you use the breast to press on the nose of the baby, and babies have to breathe through their nose. That's the only way they can breathe. So, and the baby can die from that. So but if you know how to do it, you can do it, and it does not, okay, it does not cause hair infection. So I hope some people have been liberated from that. All right, the next myth is that, oh, this one is a very popular myth, and this is, I remember speaking on BBC World Health Radio, and I really talk about this myth, that the first milk that comes out from the baby is from the mother, rather, is sour milk. People believe that, because that milk does not look white and it looks a little bit yellowish. It doesn't look like the typical milk that we always are familiar with, which is white and all that. Then they think, oh, that means it's bad. It is bad milk. It is sour milk. Yeah, we should not give it to the baby. We should throw it away. Oh my! Don't ever do that. That first milk that comes out from the mother is what we call colostrum. That colostrum is what we call liquid gold. It is the baby's first immunization. It doesn't look like normal milk. It usually looks more like amber, like yellowish, or like water, colorless kind of picture. And it contains a lot of what we call antibodies. It contains a lot of agents that protects the baby from infection. In fact, it is the baby's first immunization, and so it should never be thrown away. So please, that first milk is not sour milk, it is not bad milk, it is colostrum. But a lot of people believe that, no, that is not milk, let's throw it away. Then when the white one come and hand, that's the one we give. No, that is a very, very dangerous myth. This is one of the most dangerous myths ever. So please do not throw away colostrum. The very first milk that the mother produced is not sour milk, it's not bad milk. It is called colostrum. It is rich in protein, antibodies, anti-infective agents that will protect the baby. In fact, we pediatricians like to call it the baby's first immunization, and it must be given to the baby because it's going to protect the baby against infection, against allergies, against so many things. It should never, never be thrown away. I hope you've learned that today. Okay, another myth is that you cannot breastfeed your baby if you are not eating well. Okay, that you will get dizzy. So there are a lot of mothers that believe that I have not eaten, so I can't breastfeed, and all that. That is actually not true. Okay, because babies are complete parasites. In other words, whether you eat or not, your body will produce the one your baby is going to eat. So even if they have to break down on your own body so that they can produce breast milk, it's going to be done. And the same thing when you're pregnant as well. So it's good for you to eat so that you have enough calories, because when you are breastfeeding, you need extra calories. So it is good for you to do that. But it doesn't stop you from breastfeeding your baby. So don't say, oh, I'm not eating, or I'm fasting and I will not breastfeed, or I'm just going to go and buy formula because if I don't eat, then I cannot breastfeed. That is not true. You can breastfeed your baby whether you've eaten or not. Of course, you need the calories for yourself so that you will not start to lose weight and all that. Well, some of you want to lose weight too, but please eat, drink. In fact, it's more than eating. The drinking is much more important. Drink a lot of water, not soda or coffee, all those things. Drink water a lot, and you will be able to breastfeed your baby. But the fact that you have not eaten does not mean you cannot breastfeed. Okay. Another myth is like after 1 year, your baby is no longer sucking milk but blood. Okay, I hear this a lot because when we tell them mothers that we want you to breastfeed for at least 2 years and beyond, then lots of mothers come back and a lot of the grannies will say, "Oh, it is no longer milk that is in your breast. So after 1 year, that is blood. Your baby is sucking blood and no milk." And I always ask them, show me the blood on the baby's mouth because most of the time you will not see any blood. You will see milk that you will see when you press the breast. So it is not true. So your baby is not sucking your blood. Your baby will only suck milk from the breast. And you can breastfeed for 2 years and it will be milk and not blood. And you can breastfeed for 2 years. I've seen mothers who breastfeed for 3 years. In fact, in those days, that's one of the popular myths. They used to breastfeed for 3 years. They used to and we like that. It's good. So there's nothing wrong with that. And I also believe some people will say there's a myth, I didn't write it down, but there's a myth that if your baby is not yet walking, you should not stop breastfeeding. I love that myth. I love it. It's a myth though, but I love it. In other words, you keep breastfeeding until your baby start walking. So those babies that don't walk by 1 year, good. The mother will keep on breastfeeding. And some mothers always ask me, "Oh, doctor, my baby is not yet walking. So I want to win the baby, but because there's a myth that says if your baby is not yet walking, you should not stop breastfeeding." I always say them just follow that one. And that's a good myth. I like that one because it helps the mother to breastfeed for as long as possible. But the truth of the matter is you're stopping your baby from breastfeeding and walking. There's something there. So if you want to stop breastfeeding, you can stop. Even if your baby is not yet walking as 1 year, that's up to you. But we recommend actually that you breastfeed for 2 years and beyond. But I love that myth because it's one of the good ones because it helps mothers to breastfeed for as long as possible. And breastfeeding for as long as possible has a lot of benefits, not just for the baby now. I'm sure I've told you about Baby Zone and we're still going to talk about it in August during the breastfeeding week. But for yourself as a mom, when you exclusively breastfeed and you breastfeed for as long as possible, you are protecting yourself against breast cancer. So it's good for you. Ovarian cancer, breast cancer, diabetes mellitus, the longer you breastfeed, the better. Okay, our time is running. I'm going to round up soon. I think I'll just give us 2 more myths and then we'll round up this part 1 of this myth and facts in children health. And I'll come back next week and continue because I've got loads and loads of myths to talk about. The 22nd one, like when you are back from an outing, you must rinse your breast before you breastfeed. Okay, this is actually a good myth. There's actually no reason why you have to, but I think if you've been out, you've been exposed to some deaths and all that. So I think this is just an hygienic thing. It's okay for you to wash your hands and clean your breast before you breastfeed, but it is just about hygiene, but it's not really like it's 100% necessary. And finally, for this section, for this part 1 of this broadcast, they believe that you must always have Ajogba. Oh, I love to find I'm ending on Ajogba syndrome. So Ajogba syndrome, for those who are non-Yoruba speaking, is this culture that when we have newborn babies, then there's always so many drugs on that the mothers would have bought, ampiclos, nospermine, grape water. They have so many of them, the multivitamins, and each time the baby has had a bath, as part of the bath routine and dressing of the baby, then they give baby each of those medication. Like 3, 4, 5 of them, they would just give everything. I remember seeing that growing up myself. Thank God I know better now. It is very, very dangerous. Okay. The truth of the matter is your baby do not need any medication. Yes, quote me. A newborn baby does not need any medication at all. All that a newborn baby needs is breast milk. In fact, some will not only give all those medication I mentioned their names, they also give herbal remedies. They will say, "Oh, this one is for jedi jedi, this one is for oka, this one is for war, this all those kafura kwalebe thing, all those things, they do everything." Oh my goodness. Or the flour, there is a flour that is very popular that they will boil and then will give baby the drink and all that. These are dangerous practices. So I'm ending on this particular myth and I want to reassured new moms, especially, and all moms, that your newborn baby do not need any medication. In fact, some mothers will ask me, like, "Oh, I was when my baby was born, we are discharged. They did not give the baby any medication." I'm like, "Why did they need to give your baby any medication? Because your baby was not sick. Having a newborn baby is not a disease. A baby being born is not an illness. So the baby does not need any medication. So there's absolutely no reason to give any medication to your baby." So thank you so much for listening. I hope you've enjoyed all the myths that we've talked about today. We've talked about myths that has to do with newborn and the breastfeeding. So next week I'm going to continue again and another set of myths that has to do with children healthcare. The most important thing is that we need to know the right thing and do the right thing for the health of our children. My name is Gemisola Wade. I'm a pediatrician, and the CEO of Ask the Pediatricians Foundation. Our goal is to make sure that our children